Hi there, I'm Gary Simonds from Virginia Tech Carilion Neurosurgery, and I want to talk to you today about a phenomena that I've been thinking about recently, about a phenomena that I think we all encounter to one degree or another. Remember how we all entered medicine kind of brimming with idealism and good intentions and a desire to help our fellow man. But then all our sweet idealism and exceptional training is put to the test. And it's put to the test by our fellow human beings. So I wanted to evaluate, to study this more, to get more into this notion, because I think it really is a real challenge. I think it's a challenge both for the way we care for our patients, but also for ourselves, for our resilience, for our ability to be able to keep this effort up. So imagine you're a doctor on call, although you don't have to be a doctor. You could be a nurse or a pharmacist or a therapist or a technician. It all still applies. But for our discussion, you're going to be a doctor. You're going to be a doctor on call, and you're going to be a neurosurgeon on call because I know that field best. So the emergency room calls you at about 3 o'clock in the morning, and they have an 80-something-year-old woman down there. She's a long-term nursing home occupant, and she has a history of frequent falls. In fact, she fell today, and now she's got major neurologic deficits, a hemiparesis. But her background is she's already very demented, and she has a DNR. Well, they found that she has an acute subdural hematoma on her CAT scan and a bunch of small spinal fractures, and they want you to come evaluate her. So you do. You go down and see her, and she's this shriveled, unkept, bent and twisted and wrinkled and bruised all over with tufts of gray hair sticking out all over the place. And she smells of urine and feces and mold and old age. And you go to examine her, and she shrieks. And she scratches at you and tries to bite you. Of course, she's paretic on one side, so she's only doing it with her right side. But there's a CAT scan, and she has this large subdural hematoma. And you think, shoot, why me, God? Why in the world did they dump a creature like this into my emergency room at 3 in the morning? Why does the freaking emergency room have to order all those tests? Do they really expect me to do something to take this woman to the operating room? Really? What possible good is it going to do this patient? What possible good is it going to do for the healthcare system or her family or society? Isn't she a DNR anyway? Oh! Well, she's a classic example of what I would call a gomer. G-O-M-E-R, meaning get out of my emergency room. An ancient, barely recognizable humanoid that drags you out into the cold midnight air. And she doesn't have to be. She could be any one of the unsavory denizens of our emergency rooms in the middle of the night. But in this case, she's just indescribably old. And I know it's hard for you guys to picture being that old, but it's getting much easier for me all the time. So indulge me for a moment, because in a fit of I don't know what, one day I decided to understand one of these poor wretched creatures better and the impact they have on our healthcare system and on our psyches, frankly. So I started an in-depth investigation of one gomer's life, her background, her time here on Earth, who she once was. And I got the following story and all the pictures from her family. So without further ado, I want you to meet Joy Olive Alexa Rydell. She's in your emergency room, and she's 84 or so. Well, she was born in Edinburgh, Scotland, out of strong and colorful stock. Our patient's mother, her name was Clarice, was an actress, and she was known as the most beautiful woman in Devon. Her father, Stan, was a merchant marine and then a pub manager, but earlier on he had fought in the Battle of the Somme and was actually injured there. Anyway, our patient, as a girl, and her family eventually moved to Torbay, England, and that's in the southwest coast of England. Her father ran something called the New Pier Inn. It was an inn and a pub. Anyway, other stories, she was left-handed and beaten by nuns until she learned to become right-handed. She was a great fan of the local harbor and had a proclivity to hang out around the fishing boats, so she was known as the harbor rat. World War II came along, and she was in her late teens to her early 20s. Of course, the war lasted 6 years for the British. And she worked many jobs, one as a fire spotter, one as an exploded bomb locator, literally looking through wreckage for unexploded bombs. She was a hospital volunteer and a USO dancer. She eventually became engaged to an SAS commando, but he was killed over the Mediterranean. She was in London for the Blitz. She was in Plymouth when it was completely flattened. And she has many harrowing stories and experiences from her time there. For example, she was in a movie theater when air raid sirens went off, and she was apparently very claustrophobic and decided she was too frightened to stay inside the movie theater and instead ran out into the streets, which was the thing you were not supposed to do during an air raid. But the movie theater was completely wiped out shortly thereafter with all its occupants killed. Late in the war, she actually went on to meet an American naval officer, and they eventually got married, and then she was moved to the United States after the war. She wasn't allowed to go directly with her husband, but had to wait for a year or so to go back to America after the war. It was a very interesting vignette from the family. When she arrived in the United States, she was brought to meet her new in-laws, and the mother-in-law took one look at her and said, "My goodness, she's the girl in the painting." And nobody knew what she was talking about, so she ran upstairs into her attic and came back down with a painting that the husband had bought before the war on the streets of New York from a sidewalk artist. And the picture was the spitting image of this new British war bride. She was kind of a classic British war bride. She was beautiful and poised and vivacious and quite funny and immensely popular. She even had a stalker who apparently was a Broadway and Hollywood actor. She eventually raised 3 children and essentially as a single mother. She enveloped them with love and caring and surrounded them with books and education and reading, and worked at a local community hospital for over 30 years. She had never finished high school, yet she apparently had read every book that was written. At one point, one of her daughters, during her snotty teenage years, asked her, "Why do you read all this trash, Mom?" And she responded, "Because I had read all the good books," and apparently had. She had never finished high school, as I said, but was apparently a crossword fiend. She could be done in minutes with a typical crossword, and so favored these very complicated British ones that were filled with metaphors and anagrams and Shakespeare quotes. She found the American crossword puzzles just too easy. She was a terror on the bridge circuit and couldn't be beat, to the point that other couples refused to play her. All this, but she was polite beyond measure and treated everybody with respect and dignity and sensitivity. And she was sweet and kind and gentle to a fault. She never yelled or scolded at her family or anyone else for that matter. She fought through multiple sclerosis and then breast cancer and a mastectomy and radiation, and she became a long-term survivor, and she never complained or slowed down. But in her late 70s, she was diagnosed with depression and began having concentration and memory problems after her husband died, and eventually was diagnosed more accurately with Alzheimer's. So she began to deteriorate, and then began deteriorating quite rapidly, began wandering and getting lost and thinking she was back in England and looking for her home in Torbay. She was actually in Washington, D.C. at the time. She was admitted to a long-term care facility where she became more and more debilitated, and she stopped recognizing her family completely. She became disheveled and confused, paranoid and defensive, and began sustaining multiple falls, and she kept being dragged to one emergency room or another despite being made a do not resuscitate patient. Eventually, she fell and developed subdural hematomas. And this occurred on multiple occasions until the point where she developed a very large one and died in a hospital emergency room, where she was unkept, bruised, disheveled, foul-smelling, drooling, covered in urine, bewildered, terrified, agitated, just completely unrecognizable as her former self, and in a form that this once dignified, brilliant, vivacious woman would have been horrified at. And of course, if you haven't figured it out, this was my mother, who was a most extraordinary woman, if you ask me. But in the end, she was demented and disheveled and unkept and cachectic and unwashed and uncommunicative and moaning and scratching and shriveled and bent with tufts of hair. She was wizened and unrecognizable as her former self. So I tell you this because I think it's good to remember the next time we do head to the emergency room in the middle of the night. It's good to remember that those we're seeing are people who are not at their best moments, when they're most full of life, when they're the most of who they want to be, of who they are and who they wish they could be. And perhaps we should pause for a moment as we see them and think about who they are, who they were, who they would like us to see them as. Think of them as and remember them as living, and I mean living, breathing, active, vital people. If you think about it, we all lead unique and special lives, full of laughs and tears and struggle and strife and joys and challenges. We're all young once, and we all would like to stay young pretty much forever. But if we're lucky, if you think about it, if we're really lucky, we're really going to be old someday, perhaps really, really old. So think about it. So the concept of dignity, it washes away from us. It washes away with time, but particularly the minute we enter into a hospital. Frankly, particularly the minute we encounter the healthcare system. And so often, so much earlier than that. And when you get into our world, the medical world, with its Spartan environments, and the ERs, and the ICUs, and the wards, it just strips away every last bit of dignity. This concept of dignity, if you think about it, one of the few sources of dignity for our patients and their families is what we have to offer and what we can give to them. We are a major source, a principal source of dignity for them and of humanity. And if you really think about it, it's often all we have to offer them. Sometimes we can't be a cure. Sometimes we can't eliminate their disease, but we can always offer dignity and humanity. Thank you.